Hello everyone and welcome to this audio podcast. This audio podcast is part of the Bostix Titus issue. This audio podcast is part of an analytical storm, as part of a giant storm and another storm of Bostix production. In this audio podcast, there will be an overview in around the sort of the sort of discussion and sort of the discussion and sort of conclusion aspects in around this works and as part of this series. So the 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 social media platform that represents the adult nephrology population, earliest threads and topics had dated back to 2009, which focused on renal replacement therapy, laboratory parameters and biomarkers, medication and pharmacy, psychology, primary care, lifestyle, electronic patient records, peer support, nursing and wellness. In around the pediatric young people cohort and social media platform, earliest threads were similar and tags dated back to 2014, and included renal replacement therapy, laboratory parameters, medication and pharmacy, nutrition, surgery, lifestyle, physical activity, electronic patient records, nursing, nursing and wellness. This highlights that online and health educational information is still wanting for the online patient population, or for the sorry for the online cohorts. While some educational gaps have been bridged for patients, given the so-called technology age, patients now also potentially contend with misinformation when seeking out context relating to health. This is primarily because there is little or no healthcare. There is little or no healthcare professional involvement or support outside the confines of the clinical environment. The topic tagging activity has are highlighted an important gap wherein educational initiatives need to be integrated and should complement the clinical care pathway between adult and pediatric between the adult and pediatric cohorts. Education delivery should be provided by allied health professionals, for example AHPs, and educational modules should be co-developed based on tags on tags and co-developed with patient and professional healthcare professional involvement accordingly. While sharing lived experiences can help shape decision make can help shape a decision making. There is now a need for more healthcare professional involvement to transition basic experiences and discussions to more educational support, and thus prompting robust care following in alignment to traditional consultations, and thus to support best practice through for example proposed online multidisciplinary team or group consultations. So this work the this the draft peer review works highlights that there is a requirement for healthcare professional involvement to support patients seeking out information, in addition to basic peer support. Education could be delivered through, for example, could be delivered through, for example, allied health professional led e-clinics. E-clinics. So in around the conclusions, over the past 16 years, So 16 years again, just to refresh, 16 years represents the duration between between the two social media platforms in context of them being initiated. So over the past 16 years, patients have been sharing lived experiences and understanding between the two online social media platforms to help inform smarter care and decision making. Patients are using online support groups are using online support groups and such information and such platforms and such platforms as space wherein they otherwise have limited peer support and communication. One could debate that one could debate that what one could debate for example, what context and information is deemed clinically relevant. An important question needs to be asked here, though. However, for example, should healthcare professionals provide should healthcare professionals provide support only if context is clinically relevant, because patients or carers patients or carers are not trained to communicate clinically relevant context. It could also be argued that the majority of shared experience through support groups is all important and relevant. Patients have their own ways of sharing information, interpreting and communicating health complexities. And while sharing experiences can help inform care and share and can help inform care and decision making, there is now a need for more healthcare professional involvement to transition again basic experiences and discussions to more educational support, and thus prompting robust care following in alignment to traditional physical consultations, and thus to support best practice through proposed online multidisciplinary team or group consultations. For example, retrospectively, education has been neglected as part of healthcare delivery in context of the physical realm, but technology can help bridge space. This snapshot investigation highlights there is a need for a healthcare professional involvement to support patients seeking out information. In addition to peer support, education could be equally delivered through podcasts and webinars. There is there there This is where, for example, the NHS or the National Health Service needs commissioning, and healthcare and where healthcare requires investment. And was this the data represented here or discussed here is part of an investigation, whereas the first UK retrospective investigation that examines educational gaps between online pediatric or young people and adult nephrology cohorts close to 2 decades, co-developing educational modules involving patients and help and professionals would prompt more joined-up care in meeting information needs and addressing healthcare information inefficiencies. Thank you for tuning in on this audio podcast. This audio podcast is part of the series in the Bostix Titus issue. This audio podcast is part of Analytical Storm and the SZtorm, and this audio podcast is part of a Storm the Bostix production.